Welcome back then from the main stage session, back here to the speaker studio. My next guest is Professor Sir Stephen Powis. Now, Stephen Powis is the National Medical Director of NHS England, a position he has held since January 2018. In this role, he is the most senior doctor within the National Health Service in England. And in August 2021, he was also appointed Interim Chief Executive of NHS Improvement. So, Stephen, welcome to the studio.
Good afternoon.
A bit busy, man. I imagine it's
always busy
at this kind of expo. And I know you've done a couple of sessions, or you've done one session already today. I know you got another one coming up very shortly. Session number one you did today: can prevention stem the tide of demand? Tell us a little bit, if anybody missed that session, tell us a little bit about what topics you were covering in there and the main key points.
Well, something I'm really passionate about. Firstly, because we all know that prevention is better than cure. Teach you that very early in medical school. Secondly, because it's important that we're not just a service that treats the unwell, but we're a health services that really focuses on keeping people well. And finally, because as a number of people, including our chief executive, mentioned yesterday in her speech, our population is getting older, which of course is a good thing because people are living longer. But of course, with that comes the burden of multiple disease, multiple conditions in later life. It's obviously in those years towards the end of the life that we see most sickness. But the good news is that much of that is preventable. Much of that are diseases where we can identify the risk factors for disease and intervene early. And so there's never been a better time over the 76 years of the NHS to focus on prevention as we see that generational change occurring, which the Chief Medical Officer has pointed out in his reports, and we see the population aging. We need to shrink the years of ill health towards the end of life. That's good for the individual, good for the citizen, and of course good for the health service, and of course good for the economy as well. So prevention is really important at the moment, and I run many of the prevention programs at NHS England, digital weight management programs, diabetes prevention programs. We help hospitals with smoking cessation programs, alcohol dependence programs, and so it's really important to me on an operational level and a delivery level, as well as it's a really important thing to do.
And I know we're covering a lot of innovation here at the show. Is there any sort of recent innovation or developments that's really going to help make this a possibility, make implementation of various things a bit easier for you?
Yeah, so we're seeing implementation in terms of digital products. Everybody talked about digital. So we introduced digital weight management program a couple of years ago. We've just published a couple of months ago on the initial evidence of how that's working. And interestingly, it's seen us reach groups and populations that we don't traditionally reach. So that's one of the benefits. So innovation around digital technology is important. We're seeing new drugs coming through. So I'll be saying one or two things about obesity drugs in the next session. Hear a lot about obesity drugs in the news. Weight loss drugs, the drugs that help you lose weight. Of course, they are a part of a whole host of things that we can do, from population measures down to healthy lifestyle measures to tackle obesity, to reduce weight. And I think those new drugs, and by the way, the clinical trials are showing that they have beneficial outcomes in terms of cardiovascular and other disease, so they are good things. But we need to work out how they fit in the range of interventions and assistance we can give on obesity. So that's going to make us think hard about our weight management services, our obesity services. So that's a good challenge to have. But it's a challenge. So that's one for us over the next few years to work through.
So it's an interesting one about the drugs. Like you say, I've seen some stories about it. You're never quite sure if it's a celebrity fad type thing, but it is actually something that, from a healthcare perspective, rather than a materialistic, as a celebrity lifestyle.
Well, of course, clinicians, and of course, we at NHS England are very evidence-based.
Yes.
So our principle is that we will deploy when we have the evidence base. And of course, we're assisted in that by NICE, who play a real key role in assessing drugs in particular, but other technologies. So as I said, the evidence base is growing through clinical trials. So these drugs will be an opportunity, will be another part of the armamentarium against the disbenefits, the poor outcomes associated with obesity, but they're only one bit of it. And so the good challenge we have is to work out where in that range of part intervention, part support, where those drugs sit. And we will work that out as we do with any set of new drugs. But it's an example of innovation in the pharmaceutical space. Lots of examples of innovation outside of the pharmaceutical space as well.
Brilliant. I know you said you're going to touch on that in your next session. Tell us a bit more about what to expect from the next session coming up this afternoon.
Well, the next session we're doing a conversational interview style session, a bit like this with Victoria MacDonald. I'm doing it with Dame Ruth May. So Ruth, Chief Nursing Officer for England, and I work very closely together, so it's a great opportunity for us to be in a conversation over what matters to us. So we'll be touching on a variety of things. Don't want to spoil it for those of you that haven't seen it yet. And then, of course, we'll have some audience questions, so we'll see where the audience take us. This is Ruth's last Expo, Confed Expo. She's announced she's stepping down. So it's a important moment for Ruth as well, because I think it's the last time, certainly in her current role, she'll be on the stage at Expo. So looking forward to having a bit of banter with Ruth.
Fantastic. If you're here for the banter, stay tuned, my friend, stay tuned. I'm
hoping that people will be there, because of course they put us on at the end, which is always a ploy to make people stay.
I'm sure they will. We've had packed houses all around. I'm sure there'll be plenty in the audience. I'll come and watch. If not, I'll come and support.
Well, we got one in the audience already.
At least one. And in terms of, you mentioned coming to the Expo, how have you found the Expo this year?
I think it's had a buzz about it, actually. I wasn't here last year. It was industrial action over last year's ConfedExpo, so a number of us stayed behind to ensure that we were there to manage that if we needed to. So haven't been up here for 2 years. It's still got the same buzz, still, the great things about ConfedExpo, the networking, the opportunity to see people, which is particularly important now because a lot of the stuff we do is online,
Yeah.
For lots of good reasons, we spend a lot of time on Zoom or Teams or whatever, and that has lots of benefits. We're not dragging people around the country for meetings. We're not, that contributes to sustainability agenda. It means people have got more use of their time, better use of their time. But it does have, some disbenefits in that you don't get that face-to-face networking and the opportunity to have the more casual conversations that are so important. So it's been really nice to catch up with people grabbing me all the time for a quick chat. Some people I haven't seen for ages, actually. Some people I see a lot, but some people I haven't seen for ages. So that bit of Expo is really nice. Full range of stuff at the exhibit. I've had a chance to wander around, see a few of the stalls. I've popped into some of the sessions. I haven't managed to get to all of them, but popped in. So I've just been at the one on Martha's Rule and heard Mary P. Mills speak. Again, that's something that my team are working on under the National Patient Safety Director, Aidan Fowler. Really important, fully behind it. Been talking quite a bit in the media about it recently. Really delighted that we've got 143 hospitals signed up, to participate in the first phase. Huge enthusiasm. So really great to see the range of sessions and have an opportunity to dip into some of them.
Brilliant. And other than the networking in the sessions, any other highlights or key takeaways that you've got from the show?
So I'm always struck with the enthusiasm that people bring to these events. So I'd spend a lot of time visiting healthcare organisations, hospitals, general practice, pharmacies, healthcare in a whole range of settings, prisons, homeless centre, hostels, and every time I go out, I meet people who are passionate and enthusiastic about making a difference for the patients and populations they serve. And no matter how tough it is, and it is tough in the NHS at the moment for the reasons that we all know, that passion always shines through. And it really is the best bit of my job. The best bit of my job is getting out, meeting people, feeling that energy. And yeah, there are, there's lots of things they tell me, lots of things that they think we could do better. And part of my job is, pointing out or helping them connect with people who might have solved some of the problems or some of the challenges they've got at the moment. So that's a great part of going out across different healthcare organisations. But it's that enthusiasm It's that passion. It's that sense of I'm getting up in the morning to do the very best I can for the people I serve. It just shines through, and it's shone through this week as well.
Brilliant. It sounds like you've had a fantastic show. It is that warm sort of fuzzy feeling that a lot of the speakers are saying.
Yeah, it may be tough, and it is tough. But that doesn't mean that we can't address that we can't continuously improve, get better, that we've lost what the North Star is, which is serving our populations, our patients. That's still there, shines through. And yeah, when it does shine through, you get that buzz and you get that enthusiasm to leave Manchester at the end of today. Actually, I'm staying on tomorrow to do a hospital visit at Salford Royal, but to leave the exhibition and leave the conference and feel, I'm re-energised.
In a better place than when you're fantastic. Yeah. So, Stephen, thank you so much for coming talking to us.
Pleasure.
I'm going to let you get on because I know you're
I've got to get to my next session.
That's it. Yeah. On to the next one. I say good luck with it. I'm sure it'll be a packed house, and say, I hope you have a fantastic session.
Yeah, and I'll look out for you in the audience, because if you are the only one, then I'll spot you.
I might talk to you through. If I'm not here, I'll be in there. But yeah, good luck with it.
All right, thanks very much. Bye.
Thank you.